Hi, my name's Tanoh. I work as a senior paramedic for East of England Ambulance Service. For the next few minutes, I just want to talk about crewmates and teamwork with respect to the ambulance service. Obviously, a lot of people are fully aware that, in an ambulance, it's a two-person team. And I mean, within healthcare, if you look at all the other branches or all the other roles in healthcare, I don't really think there's many other roles that have it where it's, you and another person. Usually teams can be relatively big. You see that in nursing, even doctor-led teams, they're usually quite big issues. So for us, it's just, you and another person. And these days, as a paramedic, it tends to be yourself and probably another colleague who has less of a skill set. So it'd usually be a paramedic and an emergency medical technician, a paramedic and an emergency care support worker. It just depends on the trust. But sometimes, of course, you might be fortunate to work with another paramedic. And I just wanted to kind of unpack it because within my experiences, I found there's just so many different layers to it. There's so many different elements to working in that two-person team. Obviously, on certain jobs, there's going to be other units there, and there's going to end up being maybe 4, 6, 8 of you. But for the majority of your 12-hour shift, it's just you and your colleague. So as I said, going back to it, usually it's a paramedic and somebody of a slightly lesser skill set. And in my experience, in the couple of years that I've been a paramedic, it's been myself and my crewmate who's an EMT. And usually when it's that sort of dynamic, you would have it that the paramedic is mainly there to provide the clinical skill, the clinical expertise, and the emergency medical technicians there to almost back you up. They're there to provide that assistance for you to be able to give the best care possible. I think one of the common misconceptions within our role is that just because you've got a paramedic and an emergency medical technician, the emergency medical technician is going to be the one who does all the driving. Now, in most cases, that's probably not the case because they are skilled up enough to also be able to recognize somebody who's critically unwell and to be able to provide a care up to a certain limit. And then that's where the paramedic would take over with things like IV medications, IV drugs, and other like airway maneuvers, airway techniques, and just that extra knowledge is what we've got. But you will still end up potentially splitting the workload between the two of you. I know that when I'm at work, myself and my crewmate, we tend to split it 50-50. So I might do the first bit of attending and looking after patients in the back of the ambulance for the first half of the shift, and then he might do it for the second half. Sometimes there might be a case where I feel like, do you know what, I want to do all the attending today. So he might then end up driving the whole shift and sort of vice versa. But of course, in that respect, if there was somebody who was critically unwell, needed stabilization, and needed that paramedic monitoring on the way to hospital, of course, it's going to be the paramedic who ends up being in the back of the ambulance with that patient. But another thing outside of the clinical side of things within this whole two-person team concept is that, working for the ambulance service, you end up in so many different situations, again, that a lot of roles within healthcare would just not see. With us being pre-hospital clinicians, we can end up anywhere. You end up in people's houses. You end up taking care of people on the streets. You end up taking care of people in public places, at events, and doing it, on a 24-hour basis. You can be doing that on day shifts. You can be doing that on night shifts, and you have no idea what sort of scene you're going to arrive to. You don't know the types of houses that you're going to, the sort of dangers at certain events, and you're going to have to. You're almost relying on that person who you're working with to kind of have your back, and vice versa. Like you're almost there to look after each other, And again, for those who have that regular colleague who you can bounce off, what they're like with certain situations, it's okay because you know each other really, really well. But in loads of different ambulance service trusts, you've got loads of relief members of staff, so you can end up working with somebody you've never even spoken to before, or that you've never seen before, and for the next 12 hours you're out here with somebody you don't know, like, necessarily, and you got to have each other's backs for, like, to keep yourself safe and for the good of the patients that you see. And yeah, I just find that it's just such an interesting concept. It's so wild. Because, as I say, you can end up being with somebody that you've never worked with before and end up just back to back acutely, critically unwell patients that you're going to, or end up back to back certain types of jobs where the scene is not necessarily the safest in the world, and you're just there constantly making those dynamic risk assessments to make sure you keep yourself safe. There's so much depth to the whole teamwork aspect of this role, especially when it is just the two of you. I think as a paramedic, as much as you may be working with somebody who doesn't have the particular same skill set as you, so as I said, with an emergency medical technician or an emergency care support worker, we still can't take away that colleague's life experience. Like, you've got paramedics out here who are sort of 21, 22 years old, arguably not as much life experience as their emergency care support worker colleague who's, in their mid-40s, been in the ambulance service 20 years, has been exposed to many different situations, is aware of what an acutely unwell patient might look like. I think it's important for us as paramedics to be able to allow those people to sort of work to the best of their ability, of course, and we need to be able to listen to our colleagues. We need to be able to reflect after certain cases with our colleagues, irrespective of their skill set, irrespective of their role, and yeah, it's just with the type of work that we do, you end up in so many emotive situations as well. We're in charge of caring for absolutely everybody, and we've all been in those situations where you're at a patient's house, loads of family are there, you've been called for their little baby who's only 2 weeks old, and to be able to have that teamwork, to have that professionalism, to almost try and make it look like you've done this all before, you've done it every day, like, that can sometimes be a little bit difficult, especially when you're working with somebody you've never worked before. But a lot of the time we do manage it, we get it done, but I think it's one of those things that we don't really take a step back to actually think, like, oh my days, yeah, like we've never actually worked together, but we managed to work off each other and just do the best we can for everyone that we saw that day, which obviously looks great for our profession and our professionalism as individuals. But yeah, it is wild. It is actually wild, and it is just so important to have that element of teamwork there, because there's so much value in our staff, and there's so much value in what your colleague knows and the experiences that they've had, and all in all, it could then help bring such a better clinical experience for the patients that you see that day, so long as you give them a chance to kind of shine. And as long as you're both working together, it's really important as a paramedic to be able to almost delegate tasks, to be able to have that bandwidth to go, okay, who have I got in the room with me at the moment? Okay, it's me as a paramedic. I've got maybe two other EMTs, one being my own colleague, and an emergency care support worker. It's up to us to have, as paramedics, to have that bandwidth to go, okay, can I get you on the airway? Can I get you doing chest compressions? I'm going to be out here doing IV procedures and drugs, and then I'll have one person potentially just doing timings. We need to be able to do that, and it's important for our colleagues who are not even the ones who are paramedics. It's just important that we all just are listening and aware of what needs to be done and making sure that we're doing the best at that particular time, you know, to make sure that we look after the patient properly, you know. So I think another sort of misconception that a lot of people might have is that obviously, okay, cool, you see two people in the front of an ambulance, both wearing green. I think there is then that assumption that they're both paramedics, which, you know, in most trusts, that's probably not going to be the case. In terms of getting to those certain levels, it just depends on the trust and it depends on other factors. To become a paramedic, you do need to have a bachelor's degree in a relevant paramedic practice degree. So in most cases, you do need to go to university, or if your trust allows it, some trusts do some internal courses where if you're already a employee of a skill grade like emergency care support worker or emergency medical technician, you can then apply to try and get onto one of these part-time paramedic courses and hopefully end up with a bachelor's degree at the end of it. As for the other roles, like emergency medical technician or emergency care support worker, a lot of that training and sort of the vacancies, you'll find that on NHS jobs. The training gets done in-house. You then go out working with either a paramedic or emergency medical technician. You hopefully get to do your skills, get the sign-offs, and you then get a qualification, usually at the end of one year. And that's off the back of doing a portfolio. The trust that I currently work at, we do apprenticeships, where you can apply to be an apprentice emergency care support worker or an apprentice EMT. You sign up, you get through the interview processes and all that. We will train you in-house for, I believe it's anywhere between 8 to 10 weeks. You then come out working to your own skill set and trying to get the sign-offs and working on your portfolio. And once that's done within a year, hopefully you get a nice shiny qualification.